Thank you. It's okay.
Yes, here is your question. Okay, so if you have read and understood, considering its surgical anatomy station, please identify the bones of the foot. Okay, let me ask you to identify number 13.
This is calcaneus.
Okay, please identify number 9.
The bone is the talus, and this part of the talus. We
Lateral
can,
tubercle.
yes,
Lateral.
that's
Okay, number 4.
uh,
Head of talus.
okay.
Right. 21.
21. This is navicular. This is
Tuberosity of navicular.
okay.
Okay, right. Please identify number 10.
This is the medial cuneiform.
Very good. 15.
15. This is the body
What
of navicular.
neck of please tell me this is the navicular
Navicular. Okay.
bone, and that was the neck of, okay.
This
21 was tuberosity of the navicular. Please tell me the parts of the navicular bone. Can you tell me the parts of the navicular bone?
We'll come back to it.
Okay, right. Please tell me, all right, okay, if you can identify number 19 over here.
This is the sinus tarsi.
Yes, yes. What is the significance of sinus tarsi?
Significance.
Importance? Yes. Okay, we'll come back to this one later. Please tell me if you can identify number 4. Is this number 4 and this number 4 the same?
Okay.
Is it? What was this? I told you.
This is head of talus.
Very good. And 16?
This is neck of talus.
Neck of talus. Very good. Okay, please tell me how many arches of foot there are and how are they formed?
There is longitudinal, medial longitudinal, and lateral longitudinal, and
Yes. Transverse.
Transverse
Please
arch.
tell me the components of the transverse arch.
Transverse arch is composed of the fifth metatarsal bone in each leg formed the half of the arch.
Very good. And the ligaments and the muscles?
Ligaments and muscles for
transverses. Muscle is peroneus longus. Ligaments are interosseous ligaments.
Okay.
They form, okay, right. If you can tell me the attachment of, all right, here. If you can identify number 6.
This is the tibio-talar ligament. Deltoid.
Yes, okay. Then tell me the attachment of deltoid.
Deltoid superior to the medial malleolus. Inferiorly to the calcaneus and
okay, we'll come back to that later. 26, please.
26, this is navicular.
Tuberosity of navicular. 18.
This spring ligament.
Yes, very good. Very good. Okay, 1.
This is anterior
Talofibular ligament. Very good.
ligament.
3.
This is the fibulocalcaneal ligament.
No, calcaneofibular ligament. Yes.
Fibular ligament, yes.
What is this 3?
It is the same.
Same. Very good. 19.
This is a posterior tibio-talar ligament.
Posterior talofibular ligament. Yes. Okay. Please tell me, all right, you can tell me what do you understand by the term mid-tarsal joint of Chopard?
Yes, metatarsal joint is composed of navicular
Talo-navicular part of
it is the navicocalcaneal part of calcaneonavicular joint and the calcaneocuboid joint.
calcaneocuboid joint. Yes, all right, which is a saddle type of joint, and this other one, talonavicular part of the talocalcaneonavicular joint is a ball and socket type of joint. Okay, please tell me what are the movements which are possible at subtalar joint,
Inversion, eversion.
and which muscles are performing these movements?
Inversion and eversion, eversion through the peroneus longus and brevis,
Very good. And inversion?
and the inversion due to the tibialis anterior and
Anterior
posterior.
and posterior. Very good. Please tell me what type of joint is subtalar joint?
Subtalar joint is a plain joint.
No, synovial type of ball and socket joint. Right. What are the bones forming?
Subtalar or
Subtalar.
subtalar?
Yes.
Okay, pocket.
Ball and socket. Please tell me what are the bones which are forming ankle joint?
Superiorly uh, tibia and fibula, inferiorly talus.
You have to tell me the muscles. Okay, trochlear surface of talus. There is synovial. It's the synovial type of hinge joint. Lower end of tibia and fibula. And right, please tell me why ankle joint is most stable in dorsiflexion.
Ankle joint is more stable in dorsiflexion due to movement of uh, uh, talus posteriorly, and its large its large part will lodged in the ankle mortise, so will be little movement, so it will be stable.
Okay. Right. All right. We'll move on because time is running. Please tell me what are you looking at?
This is the dorsum of the foot.
Okay. Can you identify the structures?
Yes, number 7. This is extensor
7.
hallucis.
Okay. Right. If you can identify 6.
It is extensor hallucis brevis.
Okay. Identify number 5, please.
It's extensor digitorum longus.
Longus, right. If you can identify number 12 over here.
It is extensor digit minimi.
Peroneus
Peroneus.
tertius. Insertion of peroneus tertius. Okay, if you can identify number 17 over here.
Number 17. It's a
If peroneus tertius is here, which one
this
would
is
it be?
tibialis anterior.
Very good. Opposite. Okay. Please tell me, right, if you can tell me how would you feel the pulse of arteria dorsalis? Where exactly would you feel the pulse?
Dorsalis pedis pulse can be identified between the first and second metatarsals over the navicular,
Yes.
just lateral to the tendon of extensor hallucis longus.
Okay, please tell me, right, if you can show me the surface marking of extensor hallucis longus.
surface marking extensor hallucis longus.
Yes. In other words, tell me the origin and insertion, if you could see in the image.
Extensor hallucis longus inserted in the dorsum of the distal phalanx of the big toe.
Yes. And
Uh,
please tell me the nerve supply of extensor hallucis longus.
Extensor hallucis longus nerve supply by deep peroneal nerve.
Okay, very good. Please tell me what are the vessels which are found deep to extensor hallucis longus?
It's deep.
And
It's a
mm,
deep tibial artery.
anterior tibial artery and vein.
Anterior, yes, anterior tibial artery.
Yes. And vein. So both. Okay, what I want you to tell me about the right, I wanted you to tell me more about, you've told me all this. Okay, yes, please. Okay, just arteries of the foot, if you can tell me very quickly. What is
Arteries.
the blood supply of the foot? Yes.
Dorsalis pedis.
And
Posterior tibial.
arteria dorsalis pedis, please tell me it's a branch of which vessel, how it enters the foot and how it supplies the foot.
Dorsalis pedis is a branch of
Anterior tibial artery.
anterior tibial artery.
Yes.
And
Then
and the posterior tibial is a branch of popliteal artery and enter the foot posterior to the medial malleolus.
okay, then divides into, where exactly it divides into two?
It divides medially to medial and lateral plantar arteries in the sole.
Yes, good. Where exactly?
Exactly.
These are the vessels which supply the sole of the foot, right? And they're
This
the
is
branches of the posterior tibial artery, not the branches of anterior tibial artery. Right.
okay. Okay,
Yes.
I said yes.
We'll do, you can revise this. We can do that later. Okay, thank you.
Okay, thank you.
Good.